ball. Here it comes. Whoa, that was a good one. All right. Whoa!
Run!
Get it, Nicholas!
Run!
Come on! Go to mommy! Hurry up! Go to mom! Hurry up, run! All right, give me 5.
This is 6-year-old Matthew Fong. At age 5, Matthew's parents were told by their doctor that this seemingly active and normal boy was likely to suffer a stroke. When Matthew was 3, he began having unexplained episodes of weakness.
He would actually tell us, he would say, "Daddy, my leg feels funny," or "My arm feels funny."
Yeah.
And we would notice a limp when he walked. He couldn't walk.
Matthew was having transient ischemic attacks, or mini-strokes, on both sides of his body. The episodes were becoming worse and more frequent. Finally, after dozens of tests, an MRI scan of Matthew's brain showed a serious and rare disease called Moyamoya.
The neurologist who diagnosed the problem called me into his office and told me what the diagnosis was. And he said nothing could be done for Matthew, and Matthew would be susceptible to having a stroke. And that just really floored me, devastated me. And I said, "Are you sure that nothing could be done?" And he said he wouldn't recommend any surgery or medication.
That they were just doing experimental.
They were doing experimental surgery, and he would not recommend it because it was too risky.
Yeah.
Moyamoya is a rare disease where the blood vessels at the base of the brain gradually clot off, so the normal blood supply to the brain is blocked. The cause of this disease is not understood. What happens then, in a desperate attempt to grow new channels for the brain's needed blood supply, many tiny vessels begin to enlarge and proliferate. On an angiogram, these vessels look like a puff of smoke, the meaning of Moyamoya in Japanese.
Moyamoya disease causes 2 problems. It causes transient ischemic attacks and stroke because not enough blood gets through to the brain as the vessels clot off. And secondly, the abnormal Moyamoya vessels are very fragile and they can bleed, causing a hemorrhage.
Call the ducks, Matthew. I decided to get a second opinion because I just couldn't stand the thought of not doing anything and just waiting for Matthew to have a stroke. So we contacted the doctors at Stanford, and mainly just to get more information about the disease, not really to find a cure.
The Fongs were referred to Dr. Steinberg at the Stanford Stroke Center. Their situation was a familiar one.
Not much is known about the disease in general medical circles because it's so rare, and it's only at centers like Stanford that there's a good understanding of what kind of treatments are available. Medical treatments, including various drug therapy for Moyamoya, are not effective, and that is well known. But I think it's not commonly known that there are some very good surgical treatments for Moyamoya disease that are quite effective in decreasing the risk of stroke in these patients.
The first time that Dr. Steinberg told us that it was possible to treat Matthew's condition, we were shocked, because everything that we had heard before was that Matthew's condition was untreatable. So when he said that, and especially when he said the surgery was relatively low risk, it was like a gift from heaven.
Yeah. We were very concerned that this was going to be experimental surgery and that Matthew would be used as a guinea pig, and he put us at ease immediately that no, this was not experimental surgery. It had been successful. He had done several, quite a few of them, and everything, worked out very well. So we felt really good right away, just even talking to him.
The way we treat Moyamoya disease is to create a new blood flow to the brain. And in Matthew's case, what we did was to take a blood vessel from his scalp, the superficial temporal artery, and under the microscope to sew that artery to an artery on the surface of his brain using very fine suture. And so we create a new channel from a good scalp artery to a good brain artery, and we essentially bypass the artery that's occluded at the base of his brain. We go around it. As a result of that, for instance, in Matthew's case, the Moyamoya vessels disappear and go away. So not only are we providing new blood supply around the occluded vessels, but we eliminate the fragile Moyamoya vessels that could bleed in the future.
Matthew had 2 surgeries, one on each side, to revascularize both hemispheres of his brain.
He did very well. In fact, he went back to school about a week later.
Yeah, a week later.
A week later, he went back to school with his scar, and it was kind of like a badge of honor. All the kids went up to him and were kind of admiring his battle scars, if you will. And he's fine. He's active. He's normal, and we can't believe it.
Yeah.
We're just so happy. In fact, Dr. Steinberg said his recovery was remarkable. Faster, faster! Go faster!
Whee!
Come on, Nicholas! You wanna go?
Yeah, fast!
Real fast!
Yeah! Real fast!
We've been in contact with other parents who have children with Moyamoya, and in every single case, the child has had a major stroke. And we feel very strongly that as soon as your child has been diagnosed with Moyamoya, seek help. Go to Stanford, call Stanford, because you know it's very possible that they're able to help your child, because they sure helped Matthew.
Yeah!
Faster, faster! Say that.
Faster, faster, faster!